In our previous video on diabetes, we were able to talk about the causes of diabetes. In this video, we are going to look at the complications of diabetes. What are the complications of diabetes? Diabetes can lead to acute and long-term complications. Let's look at the acute diabetes complications. Acute diabetes complications that can be life-threatening include hyperosmolar glycemic state, diabetes-related ketoacidosis, and severe low blood sugar. In hyperosmolar hyperglycemic state, this complication mainly affects people with type 2 diabetes. It happens when the blood sugar level is very high for a long period of time, leading to severe dehydration and confusion. So the blood sugar level can be over 600 mg per deciliter. It requires immediate medical treatment. For diabetes-related ketoacidosis, this complication mainly affects people with type 1 diabetes. It happens when the blood body does not have enough insulin. If the body does not have enough insulin, it can't use glucose for energy, so it then breaks down fat instead. This process eventually releases substances called ketones, which then makes the blood acidic. This brings about labored breathing, vomiting, and loss of consciousness. Diabetes-related ketoacidosis requires immediate medical treatment. For severe low blood sugar, it is also known as hypoglycemia. Hypoglycemia happens when the blood sugar level drops below the level that is normal for a healthy human being. A severe hypoglycemia is a very low blood sugar level. Signs include blurred or double vision, clumsiness, disorientation, and seizures. It requires treatment with emergency glucagon or medical intervention. Let's look at the long-term diabetes complications. When the blood glucose level remains high for too long, it brings about the damage of important tissues and organs in the body. This is mainly due to the damage of the blood vessels and nerves, which then support the body tissues. Cardiovascular issues are the most common type of long-term diabetes complication, and they include coronary artery disease, heart attack, stroke, and atherosclerosis. Other diabetes complications include nerve damage, which can be known as neuropathy, which causes numbness, tingling, or pain. Nephropathy, which can lead to kidney failure or the need of dialysis or kidney transplant. Retinopathy, which can lead to blindness. Diabetes-related food conditions, skin infections, amputations, sexual dysfunction due to nerve or blood vessel damage such as erectile dysfunction or vaginal dryness, hearing loss, and other health issues such as gum disease. Individuals living with diabetes can also have mental health issues. People with diabetes are 2 to 3 times more likely to have depression than people without diabetes. In the next video, we'll talk about the diagnosis and test and management of this condition known as diabetes. Please don't forget to share this video with your friends. See you next time.